The regular meeting of the Minneapolis Public Health and Safety Committee for February 16th, 2022 will now begin.
Good afternoon, everyone. Welcome to the regular meeting of the Public Health and Safety Committee for February 16th, 2022. I am Latricia Vitaw, and I am the chair of this committee. As we begin, I will note for the record that this meeting has remote participation by members of the City Council and city staff as authorized under Minnesota Statutes Section 13D-021 due to the declared local public health emergency. The city will be recording and posting this meeting to the city's website and YouTube channel as a means of increasing public access and transparency. This meeting is public and subject to the Minnesota Open Meeting Law. At this time, I will ask the clerk to call the roll so we can verify a quorum for this meeting.
Councilmember Wansley-Warlaba.
Aye.
Councilmember Rainville.
Aye.
Councilmember Ellison. Councilmember Palmisano.
Present.
Vice Chair Payne.
Present.
And Chair Vitaw.
Present.
There are 5 members present.
Let the record reflect we have a quorum. In recognition of February as Black History Month, Fire Chief Brian Tyner has challenged council members to open each public meeting with a historical fact tied to Black History Month. In that spirit, this week in Black history, Frederick Douglass was born into slavery in 1817. Douglass escaped slavery in 1838. 7 years later, in 1845, he wrote his autobiography. The publication of that autobiography put Douglass, a runaway slave, at risk for recapture. Douglass then left the U.S. for England to escape danger. A year later, in 1846, he was able to purchase his own freedom for $711.66, or $25,985 in today's money, and returned to the U.S. as a free man. With that, the agenda for today's meeting is before us. There are 9 items on today's consent agenda. Items 1 through 4 are referrals or ordinances from the City Council to staff. These are ordinances from the last City Council term that have been reintroduced at Council and referred to the Public Health and Safety Committee. Each of these ordinances is being referred to staff to continue work on the subject matter of these ordinances. Item number 1 is referring to staff the subject matter of a lead paint disclosure notifications ordinance. Item number 2 is referring to staff the subject matter of an employee authority in immigration matters ordinance. Item number 3 is referring to staff the subject matter of a small and underutilized business program application to contractual amendments ordinance. Item 4 is referring to staff the subject matter of an amplified sound permitting ordinance. Item number 6 is a National Association of County and City Health Officials grant acceptance to address vaccine hesitancy. Item number 6 is authorizing an issuance of requests for proposals for implementing projects that improve community well-being. Staff talked with me prior to this meeting and requested that item 6 be pulled from today's agenda. I'll move to delete this item along with approval of other items on today's consent agenda. Item number 7 is authorizing a contract amendment with Special School District Number 1, Minneapolis Public Schools for COVID-19 investigation and contact tracing. Item number 8 is authorizing a grant amendment from the Minnesota Department of Health for prevention and management of diabetes, heart disease, and stroke. Item number 9 is accepting the 2022 Urban Scholars Program funding from partner organizations. And item number 9. And is there any discussions on these items? I'd also like to note that Councilmember Ellison has joined us in the meeting. Thank you, Councilmember Ellison.
I'm here. Thank you, Chair.
Thank you. Seeing none, I'll move approval of items 1 through 5 and items 7 through 9, and for the deletion of item 6 from the agenda, and ask the clerk to please call the roll.
Councilmember Wansley-Warlaba,
Aye.
Councilmember Rainville,
Aye.
Councilmember Ellison,
Aye.
Councilmember Palmisano,
Aye.
Vice Chair Payne,
Aye.
and Chair Vita.
Aye.
There are 6 ayes.
That carries, and the consent agenda is approved. The next item is a discussion item. Item 10 is the first term item on today's discussion agenda. It's a contract amendment with organizations providing services under the Minneapolis Strategic Outreach Initiative. We have Director Sasha Cotton from the Office of Violence Prevention and Deputy Chief Waite from the Police Department are here and are going to give a brief presentation on this item and answer any questions council members have. With that, I'll yield the floor to Director Cotton to begin this presentation. Thank you.
Thank you, Committee Chair Vita. Thank you, council members, for welcoming us here today to offer an updated presentation on the Minneapolis Strategic Outreach Initiative and the renewal of these said contracts. First slide, please. So a little bit of background on the Office of Violence Prevention and how we do our work. The Minneapolis Office of Violence Prevention uses a community-focused public health approach to keep people and communities safe. We work to prevent violence, support those impacted by violence, and help individuals and communities heal from violence. Some might hear us talk about our work through the public health approach, addressing those areas as primary, secondary, and tertiary prevention. And in addition, we do all 3 of those primary approaches through a couple of strategies, the first of them being evidence-informed strategies and replications of said strategies. We work to build capacity and to innovate work on the ground in Minneapolis, and we mobilize programs and projects that are youth-centered and focused on preventing youth violence. Next slide. So model practices, we in our evidence-based practice portfolio replicate 3 major evidence-based strategies. Those are our group violence intervention strategy, our Next Step program, which is a hospital-based violence intervention strategy, and then our Minneapolis Strategic Outreach Initiative, which is the model that we're here to discuss today. And that's a replication or an informed program by Cure Violence. Cure Violence is the national leader on this particular kind of strategy, and we've been working with them over the last more than a year now in the implementation of our Minneapolis Strategic Outreach Initiative. So a little bit of background on Cure Violence. Through the Cure Violence approach and training, they've provided over 100 hours to some of our outreach workers. Our leadership teams have received a 40-hour training focused on leadership, and all of our outreach staff, including leaders, have received 40 hours of training on general implementation, as well as some booster trainings. So we've really doubled down on trying to ensure that our teams are getting the best high quality training to do the work. This project focuses on preventing shootings by identifying and mediating potential lethal conflicts and following up to ensure that these conflicts do not get reignited. It works with those at highest risk to help reduce the risk of them committing or being a victim of violence by communicating the cost of using violence and helping people to access social services that might be needed and that help put them on a path towards safety and healing. And then lastly, we mobilize the community to change norms around the use of violence. Next slide, please. So again, this model practice is rooted in scientific research, and there is strong evidence that supports that models like Minneapolis that are using the Cure Violence approach can greatly reduce and impact violence when they're implemented with high levels of fidelity. As you can see across a variety of cities in the US that are listed here, Baltimore, Philadelphia, New York, and New Orleans have all seen significant reductions as they've implemented and evaluated the use of a strategic outreach model. It has been independently evaluated in these cities, And we hope that after a few more years of our implementation, we also will be able to do independent evaluation. It does take a number of years of implementation before your work can be evaluated independently. And so we're not eligible for that kind of evaluation just yet, but we are collecting data and doing some internal evaluation at this time, being less than a year out from the actual implementation date. Next slide, please. So the local iteration of the Minneapolis strategic outreach model is a coordinated public health driven strategy that's treating violence as a contagion and working to prevent and reduce community violence by stopping its spread through the work of violence interrupters. So for the record, this Minneapolis strategic outreach initiative is often referred to as interrupters. So people are clear, this is the interrupter work that our city is engaged in. Violence interrupters are trusted community members who work as outreach workers in neighborhood-specific teams. They work to detect potentially violent situations, and they use informal mediation, non-physical conflict resolution, and their interrupter training to de-escalate situations before they escalate to violence. This work relies heavily on the influence and relationships that those outreach workers have in communities, and is designed to serve Minneapolis city with the unique demographics that we have in communities across our city. It draws inspiration from the evidence-informed model in this work. And like I said already, one example of evidence-based strategy around implementing strategic outreach is the Cure Violence model, which is who has been providing our technical assistance and training. In 2021, 7 contracted organizations were selected to operate teams of violence interrupters, and organizations were selected through a request for proposal process that identified eligible providers through our procurement process in the city. Next slide, please. So the local iteration, again, of violence interrupters, we think it's really important to be clear what violence interrupters do and what they don't do. So violence interrupters are specifically charged with detecting potentially violent situations via outreach, and specifically working in their designated areas of the city. They are charged with providing support and resources to people at risk of involvement with violence. We ask them and rely on them to use informal mediation, non-physical conflict resolution, and the violence interruption tactics that they've been trained in to de-escalate situations and cool down violent situations. And we mobilize community to reject community violence. To be clear, violence interrupters do not carry firearms or weapons. They do not provide law enforcement functions or work for law enforcement. They also do not provide information to law enforcement. This is critically important for the credibility of the work because they are working with high-risk populations that often have a criminal history. We want to ensure that our communities recognize that these folks are there and on the ground specifically to help people make life changes and get on a path towards health and healing. They are not there to collect information for ongoing criminal investigations or to support investigations at the law enforcement level in any way. And they are not sharing information with law enforcement about what they're seeing or hearing from clients on the ground. That would violate any relationship and any trust that's being built. Lastly, violence interrupters do not respond to calls for service through 311 or 911. As we build out and reimagine public safety in our city, there is definitely a need for alternative response to 911. And we've seen a great deal of work being built out of the Office of Innovation around alternatives such as the Behavioral Crisis Unit, which does respond to 911 calls for behavioral health interventions. But violence interrupters and the vast majority of the work coming from the Office of Violence Prevention is done through relationship in community and not by 911 or 311 deployment. On the other side of the screen, you'll see the areas of service right now where we have interrupter teams. Our priority areas right now are the first strip is in South Minneapolis and focuses on the Central, Powderhorn, Bryant, and Bancroft communities. The second area is the Lake Street corridor, and that's a really long stretch of territory, primarily starting around High Lake or the Hiawatha Lake intersection and working all the way up to the Uptown community. We have a team that's focused on the Broadway area and everything north. We have a team that's focused on and around Broadway and South. We have a team that's focused exclusively on the Broadway corridor, given the high rate of gun violence that we've seen on that corridor. We have a team focused on downtown, and then we have a team that's focused on Cedar Riverside. We realize and are very upfront that there are lots of needs beyond these key areas, and as we continue to grow the project, we hope and anticipate that we will also be able to add teams to this roster. Next slide, please. So thinking about different approaches around outreach, we wanted to highlight a project that we did in 2021 that is sometimes confused and conflated with the interrupter model, and that is our community patrol project. In 2021, the City Coordinator's Office presented an item to City Council seeking an opportunity for contracts with community organizations to do work during and after the trials of former officers involved in the killing of George Floyd. The council action was approved by the City Council and signed by Mayor Fry, and the City Coordinator's Office identified the Health Department and the Office of Violence Prevention to conduct a request for application and manage contracts with community organizations to provide this service. Multiple city departments collaborated on this request for proposals that ultimately identified a number of agencies for these contracts. Next slide, please. This work was different from violence interruption, and we want to call that out. This work was really designed to help prepare community for the presence of large-scale law enforcement and the potential outcomes of the Derek Chauvin trial, the community frustration and tension that was being experienced, and to help support community in and around protesting. The outreach teams provided positive outreach and community engagement. They were supposed to support two-way communication between the community and the city, provide informal de-escalation, mediation, and conflict resolution, and share information about existing city resources and community resources that might help support community members who are experiencing the stress and trauma during and after this particular very high-profile trial. Some of the lessons that we learned from this particular pilot project was that having outreach teams, some of whom are already doing interrupter work and also participated in this project, was very confusing to the public. That's one lesson learned, that we need to be very clear about who and how we're funding, and that the public is very clear about the work that we're asking agencies to do. The second lesson learned, I think, and as we explored this with community and internal stakeholders, is that moving forward, the Office of Violence Prevention does not have any role in protests or supporting any community protests. We recognize that there is a need for crowd control at protests, but we don't see that as a fit within the Office of Violence Prevention's core purpose. And so moving forward, after having experienced this short-term project, we will not be doing any of that kind of work. We feel like that is better handled by law enforcement and other agencies. And so that's a major lesson learned from us as we distinguish our work moving forward in the vein of violence interruption from this project, which was time limited and just for the duration of the Derek Chauvin trial and the immediacy afterwards. Next slide, please. So the Minneapolis Strategic Outreach Initiative has had an extensive amount of training and technical assistance. As I'd mentioned before, leadership from each of the contracted organizations completed 20 hours of leadership training. Leadership and all violence interrupters from the organizations completed 40 hours of violence interruption and reduction certified training. So each one of them left this training opportunity as a certified violence interrupter. The leadership and interrupter trainings were provided by Cure Violence Global, which is the leading national organization focused on violence interruption. In June, the Biden administration invited Minneapolis to be a part of the 16 cities who are participating in a national community violence intervention collaborative. I actually just concluded a call with the White House and our mayor in relationship to this work. Participating cities were matched with national agencies with expertise in violence prevention and technical assistance. For this particular project, our technical assistance provider is the Health Alliance for Violence Intervention, and they have conducted a grounding orientation for our community violence prevention partners and a landscape analysis with those partners to better understand the scope of our community violence intervention efforts and to inform our forthcoming strategic planning and the needs around that. Following that, they have focused in on providing support with ongoing strategic refinement related to the Minneapolis Strategic Outreach Initiative. That's a lot of words, but the long and short of it is that the Biden administration and this particular project are going to be helping us over the remainder of 2022 to really take a deep dive on refining this project. It is the newest of our evidence-based strategies. We believe it's doing some really great and important work, but we also want to make sure that we are constantly investing in making it the best quality program for the city and for our constituents. And with that in mind, with it being new, we wanted to focus our energy on this unique opportunity with the White House and the expertise that they are bringing to bear on this new initiative. Next slide, please. The Minneapolis Strategic Outreach Initiative's impacts. So this is sort of a high-level data review. From May to October of 2021, each of our teams conducted an average of approximately 20 contacts. Contacts meaning engagement, deep engagement with individuals. So not just high-level street involvement, but offering services, engaging and building relationships, and then 30 mediations each. So that's for each of the teams, 200 contacts and 30 mediations. Again, defining contacts are engagements with individuals at high risk of being a victim or perpetrator of gun violence, and then mediations are defined as active engagements to de-escalate a conflict that could lead to gun violence. Because this is a new effort, development and implementation of evaluation measures is ongoing, and right now we are working with our teams on their end of year report from the contract period in 2021. Next slide, please. And that concludes my presentation. Thank you all so much for your time and attention and support of this very important work. I will stand for any questions from the committee. Thank you, Madam Chair.
Thank you, Director Cotton. Are there any questions? Councilmember Payne.
Thank you, Madam Chair, and thank you, Director Cotton, for that presentation. That was actually really helpful for me to understand some of your work. And one of the things that I was curious about that I think your report actually started to speak to, but maybe we could unpack a little bit more, was it's very clear to me that the effectiveness of the violence interruption model requires that community credibility, and as such, those interrupters ought not, directly be kind of sharing info with the police department, but it feels like the outreach program that you learned some lessons from had a more explicit purpose of connecting city communications with the community. And I'm just curious around, are there any lessons that we can learn around how some of these interruption efforts better integrate with or collaborate with the police in terms of at least having, I'm trying to get a deeper understanding of how the police department can collaborate with some of these initiatives, and if there's a gap in that, if we can think through potential ways of closing that gap, if that question makes sense.
Yeah, I think I'm going to give my best answer possible, and then if it's not clear, let me know, Councilmember. Thank you, Councilmember, for the question. Thank you, Madam Chair. In this particular initiative, and really per Cure Violence guidelines, our work should be pretty blind to the police. So there should be minimal to no engagement per the research. And that is really designed with the concept in mind that historically group involved individuals see the police as their adversary, right? That they have, over years spent a high level amount of time often engaging in criminal activity and avoiding the police. And so for outreach interrupters to be seen as working collaboratively with the police could dwindle their credibility and their ability to build those relationships that would allow them to have the influence to compel someone to put down the guns, change their lives, trust these interrupters. So we, in this strategy, don't work very closely with the police at all and really ask our partners in the police department if there is a request. Let's say there's a particular hotspot where there's gang activity that they're aware of and feel like interrupters could be valuable, that request come through our office and not be directed explicitly to teams. Again, really wanting to build that firewall between the individuals doing the work and officers. And so that's sort of the vein of how we try to operationalize this. There are other project areas like our group violence intervention strategy where we do work more intentionally with law enforcement and take referrals around those who can be diverted into community-based programming. And we're happy to come back and talk more specifically about that strategy and how that partnership with MPD looks. But in this vein, we should not see our teams working directly with law enforcement. And the only exception where community might see law enforcement and our interrupter teams out in community at the same time would be at scenes of a shooting. And in those cases, they are there at the same time, but doing very different work. And so it should be clear to the community that they are not there working with or for the police, but are really there acting in a community capacity, trying to keep community members calm, trying to de-escalate any other conflict and bring peace to that area.
And then a quick follow-up question. Do you know if the police department has any formal protocols when they do reach out to you as the director of OVP? Are there conditions that are met when it's advisable to reach out to Office of Violence Prevention, or is this completely ad hoc and based on, case by case?
I think, thank you for the question, Co-Chair Payne, and thank you, Madam Chair. I think that we are still working to build out some infrastructure in that vein. I can't speak to the process that our partners at MPD use to arrive at the decision making, but we do have Deputy Chief Kathy Waite here on the line who might be able to speak to that.
Thank you so much, Director. I certainly can speak to that. Councilmember Payne, thank you for your questions and for having us here today. Certainly when situations arise in which case we feel it would be beneficial to have additional support, it's always helpful for staff out on the street. So it could be a street supervisor that would be reaching out up their chain of command, and at times already having deep relationships with Director Codgen herself and reaching out directly to her to make that request. It at times can be really volatile, and the benefits of having interrupters on scene to support community is always to everyone's benefit. So we do urge folks to make those calls directly to the director for assistance.
Thank you.
Thank you, Vice Chair Payne. And next we have Councilmember Rainville.
Thank you, Madam Chair. I do have a couple questions for Director Cotton. So how are these violence interrupters evaluated? So you had some working last year. Do you know if they're capable of carrying out what you want them to do? Are there new groups that you're looking at? Could you maybe explain that a little bit?
Sure. So we are, thank you for the question, Councilmember Rainville, and thank you, Madam Chair. We are in the process of doing and having our interrupter teams complete an end of year report from their work in 2021, which will inform our evaluation process in partnership with the work that we're doing with the White House. So we're working with them to develop some evaluation criteria and a scoring system so that we can better evaluate the success of each team and where there might be operations and opportunities for improvement. We've also had our teams from Cure Violence, who is the technical assistance provider we've been working with here on the ground, and they provided us with feedback about strengths and weaknesses of each team. So we are working on an ongoing evaluation process, but really with a focus of building the capacity of those organizations, recognizing that this work is so new. And we've invested a great deal of time and energy in building out the operations of each of the organizations. So our goal is not to build out systems that are purely punitive, but really to build out a system of workability in hopes that each of these teams remain a good fit. But clearly, if someone were to violate the trust of community or the city, we would have to take deep consideration into moving forward with those operations. But to date, all operations appear to be moving in good and positive directions, and we have a level of confidence in the work that's been performed based on number of contacts, mediations that they've been able to perform, and the feedback from our technical assistance providers as they've been on the ground about their capacity and where they measure up amongst other teams doing the work.
Thank you. So I've been very impressed with a group called A Mother's Love. How were they applied to be one of these violence interrupters? Did you have a mechanism or say 21 Days of Peace, a newly formed group, which appears to me to be highly effective? How would they apply and take part in these efforts?
Yes, thank you for the question again, Councilmember Rainville. Thank you, Madam Chair. We are going to be looking to, as I had mentioned before, to increase the number of our teams. And so we anticipate, actually right now, we have a small application process pool open for one interrupter team that we're looking to fill a gap for. And we're hoping that if there are additional funds and investments in this project, we'll be able to expand our teams. But the existing teams all went through a rigorous application process and were selected through the city's procurement process. And these are ideally teams that we want to keep in rotation. And so as we build out the strategy, we hope to be able to add other teams, and those teams could certainly participate in future application processes. And that is generally the way that the city allocates its resources, is through a request for application and a competitive bid process.
Yes, I understand that, but generally the city also has a way to monitor the effectiveness and evaluate groups, which I'm hearing you say that you really don't have a way to evaluate the effectiveness of the current group.
Councilmember Rainville, Madam Chair, I would not say that that was my answer at all. We are monitoring the progress, we are evaluating the outcomes, and we are working closely with technical assistance. As I'd mentioned before, we are in the process of collecting end-of-year data from all of our programs, and we'll be able to provide feedback at a future council member with data and outcomes from each of those programs in a more conclusive way.
Okay, well, and I'm not trying to put words in your mouth, so I'm sorry if you heard something that I did not mean. I guess I'm just concerned that because there's hasn't been an evaluation yet, that there won't be the opportunity for new groups to participate. And I'm just suggesting that perhaps some of the existing groups would not meet the high standards that you have set up.
Yes, thank you for the question, Councilmember Rainville, Madam Chair. I think after the evaluation process, we will be able to, as I said, provide a more conclusive answer, but the real factors remain about fit. So we're always looking for organizations that we think can fit and meet the needs of this particular project, which again really looks at credible messengers, those who have ongoing history of working with groups and gangs in the city and have built that credibility. And as we continue to expand the work, we hope to expand the groups and to be able to measure and quantify the success of all of those working with us.
Great, thank you. And just so the evaluation will be done in a month, 6 weeks?
The end of year reports are due in early March, and then we'll be working with other partners in the city and our national TA provider to quantify that report. I would imagine that we can provide updates in Q2.
Great. Thank you, Director Cotton. Thank you, Madam Chair. That's the end of my question.
Thank you, Councilmember Rainville. Councilmember Wansley-Warlabaugh.
Thank you, Madam Chair, and thank you, Director Cotton, for its comprehensive presentation. What has come across very clearly to me from your presentations, OVP is doing important work, and I'm really glad to see the city is seriously investing in alternatives to traditional policing and delivering high quality public safety services. But we also know that that requires a unified, coordinated, and well-funded approach so that groups can operate as some of the things that you've outlined in their respective niches, but also doing so in a way that makes sure that these approaches are being extended citywide. And thank you also for laying out some of the context of how OVP came into fruition. It expanded in somewhat of a crisis context. So we understand that the program is still working through a number of challenges, and I'm glad that you highlighted that and highlighted the reflections that you all are considering as you roll out key aspects of this program. But for me, I'm really looking forward to how, we can support OVP as a basis of, combating a decentralized, subcontracted approach to public safety, and looking forward to working with you to make sure that we're continuing the funding and coordinating and centralization and standardization that's needed to do this crucial work. But some of the key questions that I have in regards to some of the information you've laid out actually segues nicely from some of the questions that Councilmember Payne raised around just this transparency dynamic of what is OVP's role and what is MPD's role. And I think you laid out very clearly that for the public, that's not always clear. So, and actually this first question, I think you shared it in your presentation, but it makes me think of Council Member Rainville's question of, can you talk about what public process currently exists for us to make selections of the groups that we work with through OVP? From my understanding, there's a public bidding process as opposed to, groups requesting depending on existing relationships with elected leaders or community leaders. But can you talk about the process that is in place for that selection?
Yes, thank you, Council Member. Thank you, Madam Chair. We, as the city, generally operate through a procurement process. So agencies are required to be entered into a bidding system, which means that they have to register with the city, register their organization as a 501c3 or for-profit business, get a bidding number in our e-supplier system. And to be clear, these are not simple or easy systems. They are hard and often complicated to navigate. We have certainly seen small agencies and nonprofits that we work with really struggle to figure out how to navigate that. Fortunately, we've been able to refer them to people inside of our procurement department to guide them through that process and provide some in-the-moment technical assistance to make sure that they can be even in the pool, right? So there's a pool of qualified applicants, right, that just are even registered within the city. Once you've been registered and are in the pool, you are then eligible to see the funding opportunities that the city offers in any given department and evaluate whether or not it's something your organization is interested in applying for. The city creates requests for applications and requests for proposals, and that is largely dependent on the body of work and the amount of money. In the case of the Minneapolis Strategic Outreach, these are requests for proposals because they exceed $175,000 and meet a couple of other eligibility requirements. That's actually the higher of the two standards. So a request for proposal application is largely handled by procurement. They are the receivers of the application. They send out the solicitation. They create a lot of the paper trail and dynamic. And then ultimately, a review panel is put together that includes staff from the city, often community partners who are not a part of any paid organization, but maybe work in schools or other, jurisdictional partners who read the applications, score the applications, and then applications are rated and evaluated based on those scorecards, and selections are based off of the applications who score the highest. And so it is a pretty comprehensive system to identify agencies for funding. It's pretty highly scrutinized and systematized in the identification process. And as I said, it comes with a great deal of rigor, both for the agencies who are applying and for the evaluation process inside of the city.
Thank you, Director Cotton, for that elaborate answer. Another question that I have, again, along this line of just crystallizing more transparency about the roles in which OVP fulfills, our broader public safety goals that differ from what MPD does. One of the things that you laid out in your presentation is, one of the strengths of OVP and your public, bidding process is that you're intentional about selecting community members to do this work, to not only go through like the leadership development, the training process, but who are, respected within their communities that have some of that credibility that's necessary to do some of this de-escalation work within our communities. But also knowing that often these community leaders fulfill a whole number of other roles and how they're showing up. So just thinking of, what are the ways in which you have communicated with, some of your OVP personnel about distinguishing, when you are doing or on the job to do OVP, particular work, and you're called, let's say, by MPD to respond to a matter. I'm just thinking of actually, I use the unfortunate tragedy that we just experienced with the killing of Amir Locke. You know, you have, OVP personnel who responded to provide support. I know you all led healing circles there. But if MPD calls them and say, we need you, some of these workers who might be doing OVP work, but they're done with that, they're off the clock, but they're being called by MPD or other groups to show up, that can be interpreted that those individuals are still there fulfilling OVP work. So how have you been in communication with your personnel to say, like, look, this is how you distinguish when you're doing OVP and when you have other requests that's coming through other leadership tables or leadership in the community to also fulfill certain roles?
Yes, thank you, Councilmember, and thank you, Madam Chair, for the question. You're absolutely right. I think one thing that's really critically important for us to remember is that the organizations who are contracted to provide Minneapolis interrupter services through these contracts are in fact nonprofits, right? They're individual nonprofits, many of whom do this work in addition to lots of other service and community. And so they may show up in community and people might feel like, well, are they here on behalf of OVP? Are they behalf of the county? Maybe, they're getting county service dollars. Sometimes they're getting money from private philanthropic partners or the state government. And so it can be a bit challenging for community to recognize how, who, and where these folks are showing up. What we have done and what we really are trying to focus on as a standard is all Minneapolis interrupters are wearing Minneapolis interrupter uniforms when they are working on behalf of the city of Minneapolis. Those interrupter uniforms consist largely right now of orange, blue, and gray t-shirts or sweatshirts, hats that say Minneapolis. We also have gloves and are in the process of procuring jackets, although it is very challenging through the city system, I will be honest, to order that level of merchandise and get it delivered at the rate of speed in which we need it. So we've been working on getting jackets for our interrupters for several months now, but are on the verge, hopefully, of having jackets that they can wear over their uniforms outside so that, again, it's really clear when they are working in their Minneapolis capacity versus their individual organizational capacity, because we know that they are out in community doing that work. In addition, we recognize that some of these organizations have relationships with other departments in the city and may be called upon by those departments, including the MPD. And so trying to distinguish and call out when they're working on behalf of the OVP and when they're working on behalf of MPD or NCR or anyone else is an ongoing process and something that we're working hard to really keep clear through uniform, but it is an ongoing challenge. And I don't believe that the MPD has existing contracts with any nonprofits, but I'll certainly concede the floor to Deputy Chief Waite to talk further about any contractual relationships they might have with agencies, or informal, I suppose, given your question.
Thank you, Councilmember. Good question that I will have to follow up on. So I'm sorry I don't have an answer for you right offhand. I know we have a number of contracts that exist with MPD, and I'm not sure who all they exist with, but I will get back to you on that.
Thank you for that. I think that will be very helpful in crystallizing, again, as we're building out OVP, the public trust around the work that we're trying to do through OVP to make that transparently clear of like, what is the role of OVP and what is the role of MPD. And my last question in regards to that, because again, we want to make sure as we're investing in our public safety alternative work, that there's clear coordination around how funding is happening for OVP efforts and also for MPD. So in thinking of the example that I just referred to about the healing circles at Bolero Flats, thank you for holding that space for residents there in light of the killing of Amir Locke. I know that was a traumatic situation, and thank you for stepping up and fulfilling that space for the residents there. But also in light, even with an investigation going on, we know that MPD is at the helm of why that tragedy took place. So I would like to know, in terms of funding for those healing circles. Has that come through OVP as you all are showing up, or has that happened through MPD or in partnership between both?
Yes, thank you, Councilmember and Madam Chair. Right now, we have worked both with Restoration Inc. and the Restorative Justice Council Action to provide healing services for residents in the Bolero Flats as it relates to the killing of Amir Locke. Condolences to his family and all those impacted by his untimely death. Right now, we are supporting that contract through our office. Both of those contracts are contracts that we've added resources to in order to supply those supportive services to the residents in the building.
Thank you. So clarification, OVP is providing those contracts. MPD has not provided financial support towards that work.
I am not aware of any contribution or anything that MPD is doing in that capacity right now, but I would certainly defer to the chief if she knows of something that I'm unaware of.
Those are all the questions that I had. Again, I'm looking forward to working with you, Director Cotton, to figure out how we can do this work in a more coordinated and sustained way, and recognizing that there's going to be bumps along the way. But I'm glad that you came to today's public health and safety meeting to publicly share, where you all have evaluated the program, reflections, how you're going to be moving differently, and some of the new, measures you're going to be taking on to better deliver services. So thank you for the work that you do.
Thank you very much for your questions.
Thank you, Councilmember Wansley Worlobot. Councilmember Ellison.
Thank you, Chair. And thank you, Director Cotton, for being here. I have a few questions, but mostly I wanted to hop on, and I felt inclined just because the presentation, I love the presentation, and as always, it's very professional, very straightforward, very humble. But I want to remind folks that this work is an incredibly young work. And if people missed it, Director Cotton, with regards to the Minneapolis Strategic Outreach Initiative, this work is less than a year old. And I would say that the number of people in Minneapolis who know about this program, given that it's only a year old, is kind of an incredible number, right? A lot of people have had exposure to this program. A lot of people have seen folks out in community, have seen folks out in the orange shirts. And there's been even a lot of critique doled out to this program, despite the fact that it is less than 1 year old. And I just want us to keep that in perspective when we think about what it takes in terms of time, in terms of implementation, in terms of training, to take a new program and implement it almost citywide. Or your program is citywide, correct? Director Cotton?
We're covering a vast number of areas in the city. We would not consider it citywide because we're not able to, we have way more requests than supply at this point, but we are covering as much of the city as we possibly can and have a roving team that's able to go pretty much anywhere in the city where there's a need. Yeah.
And in addition to being a young program, in addition to scaling up and being in multiple parts of the city almost immediately, there are also other programs that are a part of the Office of Violence Prevention, and so I want to, which are also incredibly young programs themselves, and there are also a number of requests that are made, as Director Cotton said, that are outside the purview of this initiative, but that the initiative still sort of rises to the occasion to meet anyway. And I'm curious. You talked about, I think, very pointedly about what it does to community trust and what it does to community expectation when you all are forced to take on work outside of your purview. But I'd be interested if you all have maybe a compiled list of things that the community has requested that sort of exist outside the purview of this initiative, and not as a way to just show how much you're going above and beyond, but as a way for us as policymakers to say, if these are community needs and it's not, and this program shouldn't be the one meeting those needs, what do we need to put in and where so that these needs still get met for community. Because obviously, if community is making the demand of OVP to fill this gap, there's a gap that needs to be filled. So I just wanted to remind folks of that. I wanted to really thank Director Cotton for the work that's been done so far. This work is being set up in a way that it can be institutionalized and be carried on into the future, well into the future. We've seen initiatives like this from my colleagues, and this is, obviously well before all of our time, or most of our time on the council. But we've seen initiatives like this pop up in the 90s. We've seen initiatives like this pop up as a way to meet crises at the moment and then dissipate and disappear, only to come back around 25 years later when we're meeting another flashpoint, right? This is an opportunity for us to sort of end that cycle and say, hey, we're not gonna sort of have a boom and bust approach to violence prevention. We're gonna invest in this long term, and we're not gonna divest from it only to then be scrambling to reinvent the wheel at some future flashpoint moment. So anyway, all of that, just wanted to commend the work, wanted to thank you for the work. I've seen, I don't know if like doing security at funerals, for example, is within the scope of the work, but it's certainly work that I've seen you all doing. I don't know if holding down safe spaces at vigils or outside of hospitals is within the purview of the work, but it's certainly work that I've seen you all doing. And there might be, to Councilmember Rainville's point, there might be programs that are plenty worthy of the city's attention that don't necessarily want to buy into OVP's model and into the Minneapolis model. And we can have conversations about how we fund those models, but we don't have to have those models compete with what we're trying to institute here. And so just a real quick question that I have, Director, is, so you guys are collecting data now, so you can do some analysis about what we have in this first year of this initiative. Have you already identified sort of potential needs for the work to go more smoothly? And what are maybe some examples of that? And then, where do you envision this work being, 5 years from now, 10 years from now? That's a little bit speculative. And so, if you don't have an answer, that's okay. But those are my two questions.
Thank you, Councilmember Ellison and Madam Chair. So first, thank you for the praise. Councilmember Ellison, we do the best that we can to meet the needs that we hear from the community and from internal stakeholders inside of the enterprise, including council members. I think as we think about the way that this work has sort of evolved and that we've seen work pop up and retreat and go back and forth, a big part of what the OVP is trying to do is look at sustainability and quality control, which is why we are doing such deep investment in evidence-based practice. So over 50% of our invested dollars go into our evidence-based strategies. And that's because it's what the research says has the most likelihood of actually reducing violence. And so working with national experts, working with the developers of these projects, where they've been able to implement them in cities and over time see decreases in violence is really important. People will often hear me say that the OVP is about trying to move this body of work from art to science, not taking anything away from art. Art is beautiful and very important, but as we think about really wanting to quantify and not just have an interpretive evaluation, but really quantify whether or not the work is working, we need to look at scientific measure. And that's really why the evidence-based practice approach becomes so important, because even if we're not able to evaluate immediately on the ground what we're doing, which in a year's time, you don't have enough data to do an outside evaluation, it is credible because we know that we're developing and implementing strategies that have worked in other places with similar and same situations to our own. And so we can lean on that understanding to really articulate how and why we're making these kinds of investments. So thank you for recognizing that and for the support in trying to institutionalize this work. As we think about visioning, particularly for this project moving forward, I think it really is about streamlining and also developing more comprehensive approaches. So one is that right now, most of our interrupters work somewhere between 20 and 30 hours a week. They are generally contracted through the nonprofit that they work for. They are not staff, so they're not receiving benefits. They often are working another part-time or full-time job and doing this on the side. We would love to be in a position to have these be full-time positions, at least for some of these outreach workers, and that this be a career trajectory. That is the goal at a national level, and many cities are there, and many cities are in our same situation where we're building towards that, but aren't quite in that place yet. So that's one of our goal areas, is to really allow individuals who are passionate and good at this work to take it on as a full-time career versus it being a second opportunity. The other piece is cultural competency and cultural relevancy. Minneapolis is one of the most diverse cities in the country. And while we have some teams with cultural specificity, we are seeing reemergence of need in lots of our cultural communities. And so we'd really like to be able to develop more culturally specific work around this kind of a strategy. We have a team that's really focused on our East African community and Cedar Riverside, but we'd love to be able to do something with our American Indian community and our Latino community and our Asian American communities, and really make sure that as we think about violence and how it shows up in cultural communities, we are developing approaches that meet those needs. And then I think lastly, more is more. And so we hear so much from our communities, whether it be individuals or youth serving entities, or really our business community, how the presence of interrupters makes them feel safer and makes them recognize that there are people, and not always necessarily the need for law enforcement, but people who are from community who are taking on the responsibility of being the eyes and ears and keeping our community safe and de-escalating conflict before it arises to a place where a law enforcement intervention would even be appropriate, and that they really want, need, and appreciate that. And so one of the things that we're thinking about is how we can expand this strategy beyond its focus currently, which is primarily on guns and group activity. Recognizing that a more holistic approach to community violence prevention and increased public safety presence by community members is something that we're hearing loud and clear is of value to our residents and people who come to Minneapolis to live, work, or play, and that this strategy, whether it's in the context of Minneapolis strategic outreach or developing something new, separate, and aside, it seems like there's a real need for public safety outreach and real livability response. People want to see outreach teams out there doing livability work, which is not the call of interrupters, but could be built into a strategy as a comprehensive approach.
Thank you for that. And yeah, I definitely see the potential and for a career path here. And you know, as the chair of POGO, I'll say like the day that I see a like a collective bargaining agreement with like violence interrupters coming through council, that'll be quite an accomplishment. So thank you for the answers to my questions, and thank you for your presentation today.
Thank you.
Thank you, Councilmember Ellison. I have a few questions, Director Cotton. Thank you also to Deputy Chief Waite for your time here. Director Cotton, this agenda item went up and I started to get lots of calls, emails, questions about the dollar amount of these contracts. Could you please just speak to why we're amending for the larger dollar amount, and then also how long is this grant period for these funded groups?
Yes, thank you for the question, Madam Chair. These amendments are not actually an increase. They're just putting funds back into these accounts for the year 2022. So it's not an actual increase to any of the contracts. The initial contract period began, I believe, in May of 2021 and ended in December of 2021. And so in order to re-up these existing contracts, which in the procurement process were documented as 3-year renewable contracts, it's just adding money for year 2 of this project. It's not re-up. It's not increasing the overall dollar amount. It was the expected dollar amount. Then I'm sorry, can you repeat the second part of your question, Madam Chair?
It was just what is the period of time for this contract with these groups?
Yes, so theoretically, it should have been January 1 to December 31st, but we are significantly behind in getting the contracts here. And so they will likely be contract periods that start in early March and go through the end of 2022.
So when these groups applied, you said it was for a 3-year contract? So like
they are for 1-year contracts with a 2-year renewable. So for a total of 3 years. So basically, excuse me, Madam Chair, thank you for the question. What that means is that as we work with and evaluate in partnership with each organization over the year time of their first contract, so long as they are meeting the basic standards, the expectation would be that the contract would be renewed for the next 2 years. We always have the ability to pull out of a contract and cease the relationship, but ideally, as we're investing in training and the build out of these programs, we don't want to see them be 1-year projects because we'd be in a revolving door situation with agencies if we didn't have a significant chunk of time as we're building out a new model.
Thank you. Thank you. Thank you. And then my last question is, I think there's some confusion in community around the work that OVP does, like the different components of OVP. So could you possibly speak to like RFPs for other work within OVP, when those are going to come out? What's the process for that? Is this the only pot of money that OVP has? You understand what I'm saying? Like I need a better understanding of like how people apply for these funds. What is the work? Are there different pots of money for different initiatives?
Yes, thank you, Madam Chair, for the question. So as I said earlier in the presentation, we function and fund in 3 key categories. The first of them being the replication of evidence-based practice or evidence-informed practice. That is our group violence intervention strategy, our hospital-based work, and then now the Minneapolis strategic outreach model. Half of our budget goes to funding those 3 programs. And the reason we highly invest in these models is because they are rooted in evidence that indicates they will be most effective. So for the record, the Minneapolis contracts are the deepest investment that our city makes in violence prevention to date. So organizations that are receiving funding to do the Minneapolis strategic outreach are receiving the most significant funds from our city through the Office of Violence Prevention. And that's that's new, as has been mentioned. This is brand new work that we have only been doing in contract, as I mentioned, since May of 2021 in this iteration. The second body of work where we fund projects is through our capacity building and innovation work. That is our Blueprint Approved Institute. So where we're micro-granting agencies and providing a significant around $50,000 worth of training package to organizations to really build their capacity around grant writing, board development, building their brand, and being able to apply not only for city dollars, but county, state, federal, and philanthropic dollars. That's a 9-month cohort project that, like I said, is both a micro grant, but about $50,000 worth of training. And then the other part of that portfolio is our Office of Violence Prevention Fund. And that is really where we're funding the, what I say is the brilliance of Minneapolis. So while we are doubling down on our investment in evidence-based strategy, because that's what the data says will work, and that's what the national research says is most effective, we realize that many Minneapolis-based residents and programs have ideas about how to bring safety to their community that may not have been researched and evaluated in the way that evidence-based or evidence-informed strategies are. And so agencies and individuals and communities and block clubs have the ability to apply for a dollar amount, which has been up to $60,000. We're hoping to increase that to $100,000 in this year's round of applications to do work that is not necessarily evidence-based, but is innovative and that they believe has the potential to reduce and impact violence in their communities. And that application is in the review process right now, and we're hoping that it will be released sometime in early March. The last bucket of work that we do is our youth violence prevention work. Much of that is done in partnership with Minneapolis Public Schools and through some of our Center for Disease and Control Prevention work. Through a grant that we, actually a new grant that we just received, it's kind of an iteration of a previous 5-year grant that we had received in the past, as well as our work with the Juvenile Supervision Center that we do in partnership with Minneapolis Public Schools and Hennepin County. So that's sort of the 3 buckets and how the funding streams around those work. So the Minneapolis work, in addition to, obviously after year 3, all of these applications having to be, renewed is one process, but we also hope that in that time, there will be either additional city resources or federal or philanthropic resources to add additional teams, which would allow us to do another application process. And for the record, there is an application to fill a gap right now that we have for Minneapolis outreach teams that agencies can apply for right now if they're in the eBidder system. If they're not in the eBidder system, they can reach out to procurement or contact our office and we can connect them so that they can apply for those resources.
Thank you. And my last question, have you given out any money yet this year?
For Minneapolis Strategic Outreach?
For any of the initiatives?
I don't think that we've established any contracts to date. All of our contracts that we have in place right now would be rollover from 2021.
Okay, thank you. I think Councilmember Rainville has a question.
Thank you, Madam Chair. Director Cotton, this is also new to me, so I have to go back with another question for you. So these contracts that you're proposing for us today to approve are in the second of 3 years. Is that correct?
Thank you for the question, Councilmember Rainville, Madam Chair. Yes, this would be the second year. Well, for year 1 was actually from May to December, so not a full year. But this would be, the second, this would actually be the first full year if we get started in a timely fashion of this project.
But yet you haven't evaluated the first year, so you don't know if indeed perhaps it's a good idea to go forward with the second year.
We have certainly collected, thank you for the question, Councilmember. We have certainly collected enough data, as I mentioned in my presentation before, around mediation and around context for our TA provider and our office with our data evaluation team to feel like there's enough information that proves that there's sustainability and quality in the project. So we don't have any questions about this project providing good service. It's just a matter of getting more complementary data to support what the outcomes are, and that's what the end of year reports are for. Agencies can't complete an end of year report until the year has ended. And so the year ended in December, and now, we had to give them some time to compile that data.
Okay, great. So in the last question, I don't know if this is reasonable or not, and if I'm not, tell me. But could you just explain each one of these groups and what they add to why they've been hired? So for example, number 1, the Central Avenue Neighborhood Development Organization. Number 2, Corcoran Neighborhood Organization. Is it appropriate to understand what these groups do?
Councilmember Rainville, I'm not sure I understand the question. In the general approval process, there's usually a synopsis of each organization. And in the application process, there's short synopsis of what the background information is on each organization. As we evaluate them, those are the things that the internal process looks at. That's the selection process made by the city. I'm certainly happy to try to give a high-level overview of each of the organizations, but I feel like that would be best done in written form versus trying to articulate that here.
Fine, whatever you feel is appropriate, but I'm just, when I see the word Corcoran Neighborhood Group, I think a neighborhood group says doing different type of work than this. So I do not want to hold anybody up any longer, but I'm just curious. I'm very, very curious about this. I wish you the best. I hope this succeeds. I'm trying to understand how it can work, and especially how it could work in the area that I represent, the 3rd Ward, which includes a large portion of downtown Minneapolis.
Thank you for the question. I'm happy to provide some background information on all of the organizations in written format. I just think it would be more digestible. And as it pertains to some of the neighborhood associations, as background, most of them have public safety components of their work and have been doing that for many years. And in the pilot phase of this work, really for fiduciary and financial reasons, we matched organizations with neighborhood associations because they have a long-standing history of doing both public safety work and working on big level finance projects. And we wanted to ensure that small organizations didn't have the burden of figuring out fiduciary responsibility on their own to ensure the success of the bookkeeping.
Well, sure. Well, thank you. So that makes sense. So the Corcoran Neighborhood Group really is just is accepting the money for this group.
Yes, Touch
because
Outreach.
They didn't have the time to fill out a 501c3 status.
So thank you again for the question, Councilmember Rainville. Corcoran Neighborhood Association works in partnership with Touch Outreach, which is a small nonprofit focused on community engagement, youth and adult violence prevention, and community safety. And so Touch Outreach is the primary point doing the actual work, and they work in partnership with Corcoran. It is more of a partnership than pure fiscal agency, but they certainly handle the fiscal aspects of the contracting process.
Thank you very much.
Absolutely, sir.
Thank you, Councilmember Rainville. Councilmember Ellison.
Thank you, Chair. And I just want to remind my colleagues too that we can always request individual briefings too. Like, you know, if we want to go over and ask questions about each specific group in the that has a contract, I think that that's more than appropriate to ask, but it's a lot to sort of to have the whole committee sit through when some of us may not have the same questions or have gotten that information before. So I want to encourage my colleagues to get individual briefings, reach out to the director, and get some of those more in-depth questions answered. And I also want to say that, you know, annual reporting, and in this case, we're not even talking about annual, right? But annual reporting is a pretty standard practice that is forced by the state, right? We just went over, you know, for instance, with the state's no-knock warrant provisions, about how, you know, the new state policy doesn't only requires annual reporting, and cities can demand more than annual, but the state standard, the state floor is annual. And so, you know, I don't want us to hold OVP to a standard that we don't hold any other organization to, or if we do, let's make sure that we are holding every single department to that standard if we're going to sort of break out of the annual reporting sort of rhythm. You know, the question, a few questions that I did have just for my own sake. Director Cotton, can you remind me how many full-time staff you have to help administer these programs and manage these contracts?
We have an internal staff of 9, and then we have 5 navigators who we inherited from Minneapolis Police Department and who primarily still work in their original capacity. So they're not doing any contract management or work related to violence prevention in this iteration. So a small but mighty bunch. That includes administrative support and really 1 contract manager.
Yeah, wow, 1 contract manager. That's a big workload for someone. When it comes to sort of the administrative support, maybe so that if we did want you to do something that was more rigorous than annual reporting, which again is standard, what do you think what would your staffing levels need to get up to if we were going to sort of ask that you bring data in a more frequent manner than just annual?
Yeah, thank you for the question, Councilmember Ellison, Madam Chair. Right now, we have 2.5 positions in our research and evaluation team that help to support data collection, the development of the end of year reporting templates, and are working on developing or acquiring software for an across the board programmatic evaluation and database system. So really being able to track service provision and how we're doing our work. In order to do more than annual reporting, we would certainly need more staffing capacity from research and evaluation. And in order to do research an evaluation that is independent, so not within the city's context. One, typically speaking from a research standpoint, less than 1 year of data is not something that you can do an independent evaluation on. You need a couple of years of actual data in order to do that kind of retroactive evaluation. And those kinds of evaluations independently cost upwards of $200,000 to $300,000 to evaluate a program of this size. And so it would both be building internal capacity as well as external capacity if we wanted to really think about that kind of level of research and evaluation. Although we do feel confident in the current evaluation trajectory that we're on, and it is the recommendation of the national TA provider that we do the evaluation the way that we're doing it. So this is not our decision making, but is really the advisement of the national practitioner who developed the model.
Yeah, no, best practices are absolutely the direction that we should be going. And so, yeah, I want to encourage my colleagues that if they have questions about best practices or about, you know, what some of the standards are at the state level with regard to, you know, data collection and research and evaluation, I think that there's, you know, a number of city staff, you know, Director Cotton herself, but also I'm sure our IGR staff or any number of folks can help you kind of understand what those metrics usually are so that we can set some realistic expectations and not hold one department up against an impossible standard that we're not necessarily planning to hold another department to. Thank you.
Thank you, Councilmember Ellison. Councilmember Wonsley-Worleboff.
Thank you, Madam Vita. My comment / question is really to implore, you know, our chairs of this committee, Madam Vita, as well as Councilmember Elliott Payne, to really work with Kathy Wake to bring either Chief Amelia Hoffman and other key leaders of MPD to really talk about very clearly what are those organizations that currently they are in partnership with, that they have identified as being consistent leaders in the community. Because what I'm noticing here is, again, like still a lack of clarity of the work that OVP is doing and how often the community leaders that we might be contracted with or that we're supporting are also fulfilling requests that's being made through MPD, and the conflation of that work. And I noted several examples again around Bolero Flats, the situation where we had OVP staff providing healing services and support services to residents for a tragedy in which MPD basically enacted. MPD should have been in coordination in providing support to those residents as well, and that it doesn't seem like that has happened. I think another opportunity where we're seeing that conflation is several weeks ago in light of Amir Locke's murder, where certain groups were allowed to preview body cam footage. And from my understanding, there's not a standardized policy of that. We need to make it very clear that those groups were not acting on behalf of OVP and may have been acting in request of MPD. And if those groups are therefore expecting to be compensated for their time, which they should be, then we should be noting which agencies who have made those requests should then fulfill the financial responsibility of compensating those groups. So I think it would be great if we could have a fully fleshed out presentation from, Kathy Way, you mentioned, going back and bringing a list of those groups. I would love if we could have that in the open discussion here on PHS so we can fully make it transparent, because I think as we're working, all of us as council members and staff, to improve the public credibility of our enterprise, of our agencies, people are really valuing public transparency of how we're engaging in relationships with community groups, how we're going about building contracting services, what's the decision-making process around it. And the best we can do that in these open forums, I think the better, but have that conversation being very rooted in this is what OVP is as Director Cotton has noted, these are the functions that this department is serving, and these are the functions that MPD is serving as it relates to external groups and how they're asking them to show up. so that, again, there's no conflation between the two. So I would really love to work with our fellow chairs to bring that presentation here so we can crystallize those dynamics and really minimize, I think, a lot of the confusion that's happening within the public and even amongst us here. So thank you.
Thank you, Councilmember Wansley-Wortleby. I will talk to Vice Chair Payne about your request and see if we can't get something on an upcoming agenda. Deputy Chief Waite, you have your name in queue.
Yes, ma'am. Thank you. So in response to Councilmember Wansley-Wortleby's comments, I have brought in Robin McPherson, and Director McPherson could speak to the contract questions that you had, ma'am.
Thank you. Thank you for the quick turnaround. Look at that. We got amazing staff here. Thank you, Robin McPherson, for joining. I think if you were able to hear any of my last comment, I think there's been, a number of questions that's really anchored in, getting clarity over, the roles in which OVP is providing, the partnerships that we've cultivated through our contracting of certain groups, and also noting that some of those groups might also overlap with existing, relationships with MPD. So just for clarity, for the public, does MPD possess a list of partners that is fulfilling, engagement roles, so that we can make that very clear to the public? And if so, what is the way to access that if it's publicly available, so that everyone knows, okay, when, certain groups are showing up to a crime scene or showing up, unfortunately, to a police-related shooting and killing, that they're operating on as, in capacity of supporting MPD as opposed to OVP. So want to know if you could share a little bit about that list and where it could be available to the public.
Sure, I'd be happy to. Thank you very much, Councilmember and Committee Chair. Really, things have changed quite a bit over the last years, but we currently have no contracts with any of these nonprofit groups that are within the community. In the past, we have had some small contracts, but they have been over for several years now. So going back a few years, we had a contract with Mad Dad. That contract was, I believe, at a maximum amount was $50,000 for that contract. And then we received a wellness grant through the federal government, and we had contracts with several groups during that grant period, which I believe was a 3-year grant, but that has been over for several years now. So since that point in time, we have had no budgetary dollars and no contracts for community groups. The only thing I can say is that the DID has had support and has had contracts with those groups. And I'm sure that they have called them out, or they have called them out in conjunction with maybe the police department, but I really can't speak to the logistics of what that is, since that is through any contracts would be through the DID.
Thank you so much for that, McPherson. A dynamic that I did note in my comment is, again, the conflation of these roles. Even if there's not a paid contract, there does seem to be, again, the charge of our law enforcement leaders is to build relationships with the community. And I think that was demonstrated in the, hours after Mayor Locke's shooting and killing, that there was a request amongst law enforcement leaders to pull together, community leaders to talk about next steps. So from my understanding, I believe there's a Chiefs Advisory Board where that might be a place where we are engaging community leaders who are showing up for, moments of harm and grief for our communities, but also in unpaid capacity. And just again, to make sure we're clarifying that that's an unpaid capacity and not to be conflated. If they do have a contract to do OVP work, that they're not showing up in that space as OVP. So do you have a list of groups that are supporting that advisory board for our chief? Because I think that can also help to, clarify that point of confusion?
Thank you. I do not personally have that list. I'm sure that we can get you some names of some organizations that have certainly helped over the past year or so. I do believe that there are a lot of groups that are helping out of the goodness of their heart and their generosity, which, you know, we certainly very much appreciate. But I do not have a list, so I would have to get that for you separately, which I'd be happy to do.
Thank you so much, McPherson. Again, just clarity for the public, again, we know that our leaders, especially in Black and Brown communities, and this is just a dynamic of living in a system of white supremacy, when you have leaders, especially Black and Brown leaders, who are serving a number of roles, they're often drawn upon to do so many things. And that can become, when we're especially bringing those partnerships into our institutions, like, you know, the city of Minneapolis, that can cause a lot of confusion for the public of what roles are these community leaders playing, because they have like 20 roles. So wanting to make sure, you know, again, when we're contracting with leaders who have these 20 roles, knowing that this is the one role that they're doing. When they clock out at 5 o'clock, and, you know, if our chief or a inspector call them to show up at a crime scene, that you should go. Thank you for your commitment to our community and showing up regardless of the situation, that is not happening under your OBP capacity. And if you are needing to be compensated, then let's figure out how to do that through the appropriate channels, if it's through MPD's budget, to make sure those partnerships are, you know, being nourished and that people are being compensated for their labor. So would love if there's a way for us to have that list, and also, again, public transparency, make sure that it's publicly available. So thank you again for, you know, Kathy Wade and Robin McPherson for that quick turnaround. Thank you, Madam Chair. That's my only comment and questions.
Thank you, Councilmember Wansley-Warlaba. Is there any further discussion? With that, I'll move for approval of item number 10. Is there any further discussion on this item? Seeing no further discussion, I'll ask the clerk to call the roll on item number 10.
Councilmember Wansley-Warlaba.
Aye.
Councilmember Rainville.
Aye.
Councilmember Ellison.
Aye.
Councilmember Palmisano.
Aye.
Vice Chair Payne.
Aye.
And Chair Vita.
Aye.
There are 6 ayes.
That carries. And item number 10 is approved. There is one more discussion item. Item 11 is the final item on today's discussion agenda, and it is a contract with the State of Minnesota Department of Public Safety on behalf of the Bureau of Criminal Apprehension for access to Minnesota Criminal Justice Data Communications Network. And I think we have Commander Glant from the Police Department here to give a quick overview of the item and to answer any questions for council members.
Thank you, Madam Chair. I'm Commander Travis Glampy with the Minneapolis Police Department. I oversee our Technology and Support Services Division. And I'll keep it really brief and kind of open it up for questions. So essentially the Minnesota Criminal Data Communications Network, CDJN, and unfortunately there's no really easy way to let that roll off the tongue, so pardon me for having to trip over that constantly. What that is it's created by state statute, and it is our basic network that we have to go through to access anything that's controlled by the BCA, which includes all the federal criminal justice networks as well as the states. So if we are going to run a driver's license, if we are going to run a vehicle to see if it's stolen, anything that those state or federal criminal justice databases touch, we have to go through the Criminal Justice Data Network. And it's meant to be a secure network run by the state. So you're bringing in a lot of safeguards when you are using this network. And again, it is all controlled by state statute, including the ability for the commissioner to charge fees, which is why we're here today, and defining the network itself. So the good news is that it is, again, a state-run project with all the securities brought to it by the state. So with that, certainly open it up to any questions, and be happy to continue on or kind of clarify anything regarding that.
Thank you, Commander Glampy, and I'm sorry for mispronouncing your name in the introduction.
No worries.
Thank you. Are there any questions? Any discussion? Okay. Oh, Council Vice Chair Payne.
Thank you, Madam Chair. Yeah, I had requested to pull this out for discussion just because there's so many issues around data practices and BCA that emerged after the killing of Amir Locke. And I was just curious around, it sounds like you're answering this, that a lot of this is just by statute that we have to go through this process to get access to some of just our day-to-day operations and access to data. But are there any conditions associated with this access that we need to adhere to, or things that would prevent us from utilizing this data based on this arrangement?
Yes, Vice Chair and Madam Chair. Every year we have to go through, or biannually, we have to all go through security training. We have to go through certification. And every agency has to have a terminal agency coordinator. It's a specific position whose job it is to make sure that all the rules are followed. And certainly with it comes the Data Practices Act that attaches to all this. In the case of a breach, we have to notify people, and there's special provisions regarding misuse of the data. So it really does come with it a lot of added consequences and responsibilities that have over the past few years evolved. So I think it's a really good thing that we have this funnel to go through, both from the security of the electronic security, if you will, the cyber security, as well as the back-end data practices security, where we're really making sure we properly educate our people constantly about the dangers and our responsibilities, as we move forward. And the other thing, too, I would add is there is a level of physical security that we have to maintain on our devices, such as two-factor authentication, background checks on people who are going to be around computers. We don't leave our computers out in the open unless it's in an area that's secured and people are backgrounded to come in. So there is also a level of physical security that's built into our devices in our areas where we are and where there could be access to this data.
Okay, thank you for that answer. That helped tremendously.
Thank you, Vice Chair Payne. Any further discussion? With that, I'll move for approval of item number 11. Is there any further discussion on this item? Seeing no further discussion, I'll ask the clerk to call the roll on item 11.
Councilmember Wansley-Warlaba.
Aye.
Councilmember Rainville.
Aye.
Councilmember Ellison.
Aye.
Councilmember Palmisano.
Aye.
Vice Chair Payne.
Aye.
And Chair Vito.
Aye.
There are 6 ayes.
That carries, and item 11 is approved. Seeing no further business before us and without objection, I will declare this meeting adjourned. Thank you, everyone.